Hey guys, my name is Dr. Aslan. I want to introduce you to my office, Waterfront Chiropractic, and some of the things that make us so different from many of the chiropractors that you might have seen before. In our office, we do something that's very special and very unique. We practice Gonstead method chiropractic. Gonstead method chiropractic has been developed by the world famous Dr. Gonstead. His clinic was known as the Mayo Clinic of Chiropractic. And it is a very specific, analytical, and difficult technique to do. Basically, it is based on engineering principles. Just like a building, when the foundation is off, so is the rest of the building, and then when the building has problems, it is not strong, it's not stable, and it actually will break and possibly fall. So in engineering, they have to make sure that everything is balanced. Well, that was the whole principle in Dr. Gonstead's work. He said every bone in the spine doesn't need to be adjusted, only the major ones that are subluxated or misaligned. He also said that the pelvis or the bottom bones need to be a level foundation for the rest of the spine to lie level. And so in our analysis and in our exam in our offices, we do something different, where when a patient comes into our office, not only do we take a very thorough history, but what we also do is a very thorough spinal analysis. It's made up of multiple components. One of the first components is using an instrument like this this is a temposcope, or other doctors use a nervoscope. It's basically the same thing. And what it is two thermocouples and a galvanometer. And basically what that is it measures heat. It measures very minute changes of temperature. When there is a subluxation of the spine, which is a misalignment that causes irritation or dysfunction in the nerve and the nervous system, at that level, at that disc level where that misalignment is, there's going to be a change of temperature due to autonomic changes and vascular changes at the level of the disc where that pressure is. And we use this to just kind of find where we're going to start. And we mark these spots off as we analyze down the spine. Then the next thing we do is we palpate, what we call static palpation, where we rub our fingers down and we feel for edema when there is a misalignment in the spine. Well, that's a form of a trauma, so we're going to find swelling and edema. The next thing that we do is we motion palpate, where we find and we check the movement and the motion of each individual vertebrae of the spine, where we found these other signs. And we mark and we're looking for decrease in movement or abnormal movement compared to what or how that joint should be actually moving. Then the next phase is we visualize the spine. We look at things that are unusual. Anything from if the person has a perfectly clear back and then we find one big pimple in a certain area. That sounds kind of funny, but actually it's a sign of dysfunction, because sweat gland activity increases when there's an increase of stress on the nervous system, right? People get stressed and they sweat. Well, sweat gland activity can cause pimples, right? We know that, and we've seen that. So we note things like that. We're also, when we're visualizing, we're bending the spine from side to side and forward and back, and we're looking to see how the spine moves. We're looking to see, as we bend the spine sideways, is there a nice clear curve going one way versus the other way? We note these things. And then lastly, we take a full spine x-ray. The reason why we take that full spine x-ray is because you need to see how the foundation, right, what we talked about earlier, how that is affecting the rest of the spine, what's happening above it, and how those bones are misaligned. One of the most important things to the Gonstead system is the specificity of how we make an adjustment. Okay? When a bone subluxates or misaligns, it misaligns towards the damaged area of the disc and the soft tissue. So if the disc is damaged on the posterior or the back right side, the bone is going to actually slip back and right. So we need that x-ray to know that, because if we were to adjust the person and pop them on the right and pop them on the left, like so many chiropractors do, we could actually be moving that bone towards the damaged area. But what we actually want to do is we want to find out how that bone is misaligned and move it away from where the trauma is, or what they actually called creep, where the bone shifted to, and move it away from that. So not only are we creating motion, we're changing alignment, okay? And we're doing it in a very specific, safe way, okay? The other thing that we do in our office that makes us unique, so that's how we manage, that's how we do the Gonstead method. We take all those components, we put it together, and that's how we find what needs to be adjusted. in our office, we don't adjust a lot of areas because a lot of areas don't do it. When you put all these components together, you're actually able to narrow it down to the specific misalignment, subluxation that is creating the problem in the spine. Another thing that we do in our office is we combined the principles of corrective care chiropractic. And what that basically is that we not only look at the individual subluxation and the individual misalignment that is causing the symptoms that you might have and altered curve, but we're looking at the global changes. In other words, the overall shape of the spine and the overall shape and posture of the patient. Is your head carriage forward? Is it shifted to the side? Do you have a normal lumbar curve or a normal cervical curve? And when these curves are out of their normal alignment, we want to restore them back to normal, okay, based on mathematics. So if somebody, for instance, has a loss of their normal curve in their neck, we may, along with our specific adjustments, we may start doing traction with that patient. Not axial traction, which just stretches, but traction to restore the curve towards normal. Their neck is straight, and we want to create a curve. So we'll do traction to help in these corrective postures, in this corrective movement and motion and alignment. And those are some of the very unique things that we do. And then we'll do exercises that do the same thing. Again, tractions, and we'll give a home care for you. We'll give you supportive care, things to do at home to support everything that we're doing in the office. Another thing that makes us so unique at Waterfront Chiropractic and our approach is simply this. We show you an x-ray in the beginning. We show you an x-ray after 3, 4, 6, 8 weeks, depending on what you need, and we actually show you a comparison. So we don't only start with telling you what's wrong, we actually show you how we fixed it. Unfortunately, many chiropractors show you what's wrong, but they never show you whether they fixed it or not. Okay? So what I like to do is I like to show you some before and after x-rays, and I hope you enjoy them.